Greetings to all our listeners. Today, we'll be exploring the medication known as Xenical, which is also available under the generic name orlistat. As always, this discussion is for educational purposes, and any health-related concerns should be addressed with a medical professional. Description: Xenical, with its generic name orlistat, is a medication designed to block some of the fat you consume, preventing it from being absorbed by your body. It is primarily used to aid in weight loss and to help reduce the risk of regaining weight that has already been lost. This medication is intended for use in conjunction with a reduced-calorie diet and is prescribed for adults. It's worth noting that while Xenical is the prescription-strength form of orlistat, there's also an over-the-counter version known as Ali. Warnings: Pregnant individuals should refrain from taking Xenical, as weight loss is not recommended during pregnancy. It's also not suitable for those with digestive disorders that affect food absorption or those with gallbladder issues. It's essential to follow a balanced diet, exercise, and weight control regimen when on this medication. Moreover, it's advised to avoid diets high in fat while on Xenical, as combining high-fat meals with this medication can lead to unpleasant gastrointestinal side effects. Before taking this medicine, you shouldn't use Xenical if you're allergic to orlistat or if you have malabsorption syndrome. It's also not recommended for those with gallbladder problems or those who are pregnant. It's essential to inform your doctor if you have a history of kidney stones, gallbladder disease, pancreatitis, underactive thyroid, liver disease, kidney disease, or eating disorders like anorexia or bulimia. Pregnant individuals should stop taking orlistat and consult their doctor immediately if they become pregnant. It's also worth noting that Xenical is not approved for anyone younger than 12 years old. How should I take Xenical? Xenical should be taken as directed on the label or as prescribed by your healthcare provider. Typically, it's taken 3 times a day with main meals containing some fat, but no more than 30% of the meal's calories. If a meal is skipped or doesn't contain fat, you can skip your Xenical dose for that meal. It's crucial to maintain a balanced diet, exercise, and weight control regimen while on this medication. Side effects: Like all medications, Xenical can have side effects. Some common side effects, which are signs that the medication is working correctly, include oily or fatty stools, oily spotting on undergarments, gas with oily discharge, loose stools, and increased bowel movements. These side effects are usually temporary and may decrease as you continue the medication. However, if you experience severe symptoms like severe stomach pain, blood in urine, kidney issues, or liver problems, it's crucial to seek medical attention immediately. Interactions: Xenical can interact with other medications. It's essential to inform your doctor about all the drugs you're taking, including prescription and over-the-counter medicines, vitamins, and herbal products. Dosage: The usual adult dose for obesity is 120 mg taken orally 3 times a day with each main meal containing fat. This dose can be taken during or up to 1 hour after the meal. The pediatric dose for obesity for those 12 years or older is the same. What to avoid? While on Xenical, it's recommended to avoid high-fat meals to prevent unpleasant side effects. If you're also taking cyclosporin or levothyroxine, ensure there's a gap of 3 to 4 hours before or after taking Xenical. FAQ: A common question about Xenical is regarding its suitability for children. It's important to note that Xenical is not approved for anyone younger than 12 years old. Closing: That concludes our overview of Xenical. Remember, this information is intended for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for joining us.